Anita Shannon from Ace Massage Cupping. I am here at the beautiful Oakworks facility in New Freedom, PA, and we are working on one of their wonderful medical lines of tables. They do massage tables, they do medical tables, and I've just explored and found that there is just a huge, huge amount of beautiful designs and great tables that they make. To be honest with you, my first table in the 80s wasn't Oakworks. It was custom built, and to be honest, I still have it and I still use it almost 30 years later. So very happy to be here. We've got a willing model who is going to allow us to demonstrate massage cupping, and this is going to be comprehensive care. Massage cupping or vacutherapies is a modality that appeals to almost every massage therapist. We can do deep tissue work, we can do lymphatic work, we can work on scar tissue, we can do anything with these cups that you want, as long as you stay within the boundaries of our licensing and do not step into either Chinese medicine or any other approach to the body that is outside of our scope. So the difference between what we do and what they do in Chinese medicine is pretty simple. We do use the same tool, but in body work, you're going to be dispersing stagnation. You're going to be stimulating blood flow. In Chinese medicine, you are doing a lot of static placement of the cups, and this is based on Chinese medical theory. Most of us don't have that background. We do have a good, solid background in A&P and in massage therapy techniques. So being a therapist of 30-some years, the nicest thing about this is it has decreased the strain on myself as a practitioner. So I don't have a lot of the repetitive movements anymore. I don't have to work so hard on my client. So this is about working smarter, not harder. And the nice thing with this too is it's easier for your client. There is no discomfort with this. If there is, back off a little bit. So our main goal with massage cupping is dispersing stagnation, which is old lymph and very old blood in the tissues from very old tears, injuries, even when you were a child. There's also a lot of wonderful stuff trapped in there, old medications, anesthesia, all kinds of different things. So you may see some very interesting things coming up to the surface. When you see a discoloration on somebody, that is not a bruise. That is old blood and old debris. If you see gray coming out on someone's back, they were exposed to smoke at some point in their life, either secondhand, it could be campfires, it could be anything. And we actually are starting a program called Foster a Firefighter so that we can start clearing the smoke out of the firefighters' lungs. So we are dispersing stagnation. We're also relieving inflammation. So this moves inflammation out of the tissues by creating vasodilation. This is usually called a counter-irritant effect. In this case, we didn't have to use heat to create the vasodilation. So now you've got a person on the table whose tissues are letting go of heat. You've got congestion that's being liquefied using that heat and moved. So now you've got tissue that can actually accept nutrition and blood flow. You've got tissue that can accept water because it's not so hot and dry. And now you've got a lymphatic system that will actually carry cellular wastes away. The nicest thing about this too is it's a nervous system sedative. So you're going to sedate this whole central nervous system. And don't be surprised if you hear a good snore coming out of your face cradle. We do have even people who drool. It's wonderful. So if you have someone with insomnia, anxiety, a lot of these different issues that present on the table, this is a great way to start that sedation immediately. So we're going to have some fun here. I'm going to start working on her back. And actually, sure with the camera, you can't really see that her left side is slightly elevated. We're going to see if we can even that out. Now these are our manual cups. In another one of our videos, we're going to show you the machine. So this is massage cupping. Meta cupping is our other piece of equipment. It's very much the same. We do a lot of the same movements. The machine makes it a little bit easier, but very often I go back to my manual stuff quite a bit. My equipment really serves me well. And what do you do if your electricity goes out? It's good to have your manual equipment around. Okay, Now our model here has some great things to show us too. She's an avid soccer player. So we've got some good scars and things here, which most of the time people don't celebrate. I happen to love scars. We can do amazing things with scars for people. One of the things we have the most fun with are women who have had C-sections. We can loosen that scarring up, let the lymph flow again, and very often drop that little bloated belly that women get. So take a look at the position of scars on your client's body. See where it is in the flow of the lymph. Has it created a blockage? And move that scar out, soften it. One of the nicest approaches is for people who have had severe burns. I don't care if they were burned when they were a 2-year-old child and they're 70. I will still work on them. We've been able to get an increase in range of motion almost immediately, and that's significant for somebody with that severe amount of scarring from childhood. So get some training, grab a cup, and add it to your practice. Now you can work 2 ways with the gun. We like the tube because you're moving the cup all the time. The cup is active. But if you want to just use the cup on its own and just leave it sit, our max is about 3 minutes to leave this sit on a trigger point, on a muscle structure. You can also do nice rounds of these. Pull that tissue up and then release the pressure one by one. I'm going to move that big one there, put a couple more on here. So let's say you had somebody come in with lung issues, very congested lungs. You can simply create your suction in rounds and then release it. So what this is doing is setting up a pumping movement right over the lung area. And is that comfortable? Mm-hmm. Okay. And then just start releasing them. And I use the valve at the top to release it. So setting up this pumping movement gets the blood moving up and back down, up and down. So what we're doing is getting a release from the lung tissue and from the muscular tissue. I really prefer to do that without the tube. It gives me a little better and easier release. But when I'm moving the cup, I want that tube back on there. Because if not, I'm going to be holding my arm up like this, and that's going to hurt us ergonomically. So just take your little green tip here and insert it into your gun. Now, you can even go ambidextrous with it. So you're never using the same hand. Create your suction, and now you can move the cup. How does that feel? That feels awesome. Good. Now really, really watch this cup as you're moving it. You saw it kind of got stuck right over her shoulder here. It just doesn't want to move. Very often I just tuck my gun, come behind it, move it over that spot, and you may see a nice dent occurring. So you see how that's pointed up in the cup? Has a little point on the tissue. As my husband says, that should look like a nice hamburger bun. This does not. She's got some adhesions in here. So now as I move that over, some of those release. So the neat thing with this is you can also evaluate your client on the table. You see that dent showing up and the way the cup just jumped. So she's got some pretty good adhesions in the infraspinatus, the supraspinatus, and you can see a little puckering in the tissue just as we get around there. The big trick to this, though, is lifting the cup. If you're pressing in on somebody, you're doing nothing but moving a cup over them. We lift it. Really make sure you do this. This is so important. Come down that nice erector there. Nice little curve off onto the sacrum. Most people just get a real kick out of this. It is a very, very different sensation than us pressing in. So very quick, you can see she's getting a nice pink color in her tissue too, getting some nice blood flow. I've never been able to do this with my hand in 30 years. Wow, this is a good one. I love it when I get a good adhesion. So actually we're getting a change in texture in the skin right over that adhesion. Getting a few little bumps kind of showing up. And I'm going to come over here to her other shoulder and see if we can find the same thing. Usually people are pretty balanced out with that. So you're seeing me doing this nice gliding movement, really lifting that cup. You can also park the cup right over this medial border of the scapula here. And come in and do some nice manipulations with her shoulder. So this is called a park and manipulate. So we do this often on the anterior shoulder too. What if you could lift those attachments up, move the shoulder back structurally, and then drop the attachments down? You've just been able to free up a frozen shoulder someone might have had for years. So I do love this, where I can park and manipulate, and you can see her elbow does not want to drop. So just very gently, I'm just going to keep moving that while I move the cup. Get under there. Those nice attachments right on that medial border. If not, we'd be digging in there with our hands. And you can do that too. Create your suction right over the spine here on the attachments of the rhomboid. Now come in and do that extension. So you've got a form of traction there. She's going to be loose as a goose by the time we're done with her. Real favorite area here. A place where we often find women especially have what they think is dowager's hump. Very often this is just old blood from cervical injuries, and it's just stuck there. And as it builds up in here, it just forces the neck further and further forward. So for all of us who have had cervical injuries, which is most of us, clear this out, and always with this you're going to move this forward on the body. So the drainage comes forward. So even though I'm doing muscular work, remember your drainage pathways. Just think of what you just sucked out of that muscle tissue. It has to know where to go. So drainage for the back comes way off the sides here. And I'm also at the same time opening up these intercostals in a really big way. You can even see where people have had epidurals. Women who have had babies, you're going to see, even if it's 25 years old, you'll see that epidural show up, and then you're going to be able to see how it traveled out. So what I do for that is come over that spot, and this is a movement called rolling rotation. And you see that little dent dancing in the middle of the cup there? Can you see that on camera? Wonderful. You see this adhesion right over her spine. So this gave us a lot of information. And again, when you're pulling and you feel a resistance, come behind it, anchor the skin, and move that up the spine very, very slowly and gently. Wowee. A little bit of some twisting movements here. Loosen that up. The big thing with this tool is to make sure you have an education on how to use this. It's really easy to throw a cup on somebody. If you don't know how to use it effectively, you could hurt somebody, and you just won't be doing it in a way that will really benefit your client. And this is what we're here for. So do keep an eye behind this cup. Watch what's in there. Watch the colors coming up. Is it red? Is it white? Is it purple? Is it gray? Is it green? You're going to see some really amazing things come up on people. Really nice work over the sacrum here too. Get a nice suction there. Come in and just move that sacrum around for her. Give her a little wiggle in her walk again.